to start off our COVID-19 update. As always, we'll offer a situational update. Our cases have continued to rise, which began in mid-July and has been pretty steady into the fall. Our past 7 days, we've had 199 new COVID positive cases. In the past 14, 449. Our 14-day case rate per 10,000 as of September 24th is not correct. As of 10/9 is 97. Deaths 76, and that is 4 more since I was here speaking to you 2 weeks ago. Cases in our school and pre-K kids in the past 2 weeks is at 27%. I believe we were at 39% 2 weeks ago. Still 1 in 3 is something that schools and childcares are significantly dealing with, but it has come down a little bit. Vaccines are there, they are increasing. However, it's very slow. We're obviously not offering vaccines in the hundreds. For new people, I should say, starting their series, the hospitals and clinics are offering boosters of Pfizer and have had a fair amount of reception to that. 12 and older Itasca residents were at 59%, 16 and over 60%, 65 and over 83%, and total population 50%. That's all starting their first dose. You can see a couple of those numbers actually slid back a little bit, and the state of Minnesota is always cleaning up the database with zip codes, and we happen to have a population that spends time here in the summer, and so if their zip code somehow changed, the data would follow them for their vaccines, because we've been as high as 86%, particularly for that 65 and older population. So it doesn't mean people obviously are getting unvaccinated. It just means that the data gets more cleaned up as time goes on and people move back to where they maybe spend their winters. Public Health has offered 7,159 doses. We are offering Johnson & Johnson vaccines weekly through October, and then if we have a little more supply, we'll extend that. We're still waiting on authorization for booster doses of Moderna. Until this happens, we won't reorder until we know that it's something we need to have. Still always offering for homebound or people that have barriers to vaccine access. We do that for influenza as well. It is influenza season, and if you call Public Health, you can access an influenza vaccine if you're homebound. We are offering in the schools. We're starting this week. October into November, we offer influenza vaccines in all the school buildings throughout Itasca County. And then community clinics will be offered on our regular immunization clinic dates, which is the first Thursday of each month in the afternoon. We will make arrangements for folks to receive their 3rd dose of Moderna. That is not the same as a booster. 3rd doses are for folks who may be immunocompromised or of a certain age, take immunosuppressing drugs. Again, we'll offer Moderna, and the clinics will offer Pfizer. And then a couple of our pharmacies also offer Pfizer, that's Walmart, and then Thrifty White by Culver's. Scenic Rivers has been able to access Pfizer. They had Moderna previously, but they are offering Pfizer at this time. Delta remains the active variant in Itasca and Minnesota, but vaccines are still showing their effectiveness in preventing severe illness, hospitalization, and death. Schools have had varying levels of activity in their buildings since the beginning of the school year. We have 2 Itasca school districts that are revisiting their learning models and may consider pausing or resetting because of the amount of cases in their building and in their district. We've had other schools implementing mask mandates. They've added in some contact tracing, more quarantining, and it's been based on their data, specifically for their buildings and their geographic school district. Cases do continue to be high. Vaccine breakthrough was a hot topic, something that we are going to address a little bit more deeply, hopefully this week in our media releases. We have 1.8% of our fully vaccinated residents having tested positive for COVID. So we're talking 21,911 people, 50% of our people fully vaccinated. 399 of those cases have tested positive. If you know a fair amount of those 399 people, it can be very easy to generalize that vaccines aren't effective, and that's just not true. You just happen to know a few of those people. Of those 399 people, 29 were in the hospital, 5 were in an ICU bed, and 4 have died. Of those 4, 1 was in their 70s, 2 were in their 80s, and 1 person was in their 90s. And those are folks who died because of COVID. We still strongly encourage vaccinations. Our hospitals remain full. That's statewide and region-wide. It's primarily unvaccinated people. So we really encourage anyone who's considering to become vaccinated. Our 5 to 11-year-olds, we're looking at authorization for that age group to be vaccinated in November. Moved out a little bit. It was supposed to be the end of this month, and now it's moved into November. CDC still recommends masking in public indoor spaces regardless of our vaccine status because our community spread is substantial to high, and it's actually high. Substantial isn't a fair word right now. There's a lot of COVID in Itasca and our neighboring counties. We're still conducting monthly press briefings, weekly media releases, and then, as always, responding to questions. We have our COVID information line, 327-6784. Calls have increased in the last couple of weeks, as to be expected as COVID levels rise.